I'm back on the floor on this, as I have been over the course of the last decade, because we've been like a yo-yo in my state of Florida on the importation of drugs, since I have quite a few senior citizens in our state. They have been accustomed to either going to Canada and bringing back prescriptions at half the price, or phoning in Canada to pharmacies and having those drugs shipped in the Postal Service, or emailing to Canadian pharmacies. And what happened over the course of the last 8 or 9 years is that the previous administration cracked down on the reimportation of these drugs. And of course, that was at a great expense to our senior citizens who can buy these drugs at roughly 1/2 of what they pay by going into the pharmacies here in the United States. And then an interesting thing happened along about 2006. Because this senator started getting multiples of calls. I think up to something like 100 complaints in that 1 year of 2006 from senior citizens who had purchased the drugs either by email, by telephone, or by going personally there and having them shipped. And lo and behold, under the previous administration, they gave the order to the Postal Service to confiscate these drugs. Well, this happened, for example, to a couple from Mount Dora, Florida. John and Lee, no, it's Mr. and Mrs. Lee Eads, E-A-D-S, from Mount Dora, Florida. They had their drugs confiscated. We went after the Postal Service. We went after the Customs Bureau. We found, in fact, that a lot of these complaints that we had gotten in, those drugs had been confiscated, when in fact the policy was supposed to be, if it was pharmaceuticals for a personal use, and they defined that as less than 90-day supply, that the government, the United States government, was going to let these senior citizens take advantage of getting that cost break of a 50% reduction. Well, it took us in late 2006 getting into this with Mr. and Mrs. Eads as the poster couple who had been getting their prescription drugs, and then all of a sudden, they're confiscated. We got the Postal Service and Customs to reverse, and this has supposedly been the policy, but we can't get it etched into law because people keep bringing up this Trojan horse that it's not safe. Well, if the very manufacturers that we are buying our prescriptions here in American pharmacies are the same manufacturers in the identical locations with the identical labeling that are the drugs that are going to Canadian pharmacies, why can't we give our senior citizens a break? Now, of course, what this senator would like to do is to give them a bigger break. This senator has an amendment which it's continuously being stated that I may not get to offer my amendment, that would cause the pharmaceutical industry to give discounts on the drugs sold under Medicare that are being sold to 6 million people that are eligible because of their low income for Medicaid but get their drugs through Medicare. Those 6 million people, Medicaid, poor people that are eligible to get government assistance, used to have a discount, a substantial discount. And therefore, the U.S. government was paying less for the drugs that it bought for those people. But 6 years ago, when the prescription drug benefit was passed, those 6 million people were suddenly made ineligible to get the drug discount because they were now getting their drugs under Medicare. Well, that's absolutely ridiculous. That the United States government is going to pay full price for the drugs now that they used to pay only a fraction? How much is that worth? Well, according to CBO, in the amendment that I offered in the Senate Finance Committee that was defeated 10-13, according to CBO, that is worth $106 billion over 10 years. That would be savings to the American taxpayer that we would be paying just for those dual eligibles, Medicaid recipients that get their drugs in Medicare, would be $106 billion of savings that the United States government would not have to pay for those drugs if we followed the same policy that we did back there before this prescription drug benefit for Medicare. Now that kind of makes common sense, doesn't it? That you want to save the American taxpayer $106 billion? But we were defeated by a vote of 13 opposed to my amendment and 10 in favor in the Finance Committee. Now, I know it's a tall order to bring this amendment out here on the floor and have to get a 60-vote threshold because 41 senators can deny the American taxpayer from getting $106 billion of savings. You know, one of the good things about our bill that has come to the floor is we're going to reduce the deficit by $130 billion. And that's over a 10-year period, and that's a good thing. But if we would accept my amendment, we could reduce the deficit by $236 billion. Or we could use part of it, say half, to fill the rest of the donut hole that the AARP would like, and so would this senator. The AARP strongly supports my amendment, and they have made it clear to the leadership of this United States Senate that they want to see that donut hole closed. But there's nothing coming out here on the floor that's going to do that. This amendment that Senator Dorgan has offered, which just in and of itself is good policy, re-importing drugs at half the cost from Canada, is a step in the right direction, but that doesn't close the donut hole. So here we are at a decision point. Who are we going to serve? Now, let me say at the outset that I understand the political dynamics here, and I want to give credit where credit is due, that the pharmaceutical industry is in fact supporting the leadership in trying to pass this bill. And that's a good thing. And we appreciate that very much. And we need their support because you have all these other interest groups that are flaking off. And at the end of the day, we have to get 60 votes here in order to pass health care reform. And that includes health insurance reform. And we've got the insurance industry just totally flat out trying to kill this legislation. So So I'm grateful to the pharmaceutical industry for trying to help us. And therefore, my plea is there's got to be a balance. There's got to be a compromise in the works. There's got to be a way of the pharmaceutical industry stepping up to the plate to help us totally fill the donut hole, that gaping $3,000 hole that seniors have to pay all of the drugs that they buy when they reach that level. There's got to be a sweet spot, a compromise. And so, Mr. President, I certainly support this amendment, and I hope that the Senate will favorably consider my amendment later on.